Hi everyone, I'm Leanne Corelli, an educational psychologist.
Hi everybody, I'm Eden Byrne. I'm 21 and we have both had long COVID since 2022. So this is a really complex subject, so we only have time today to give you a flavour of why this is so important and what you can do when working with young people and children who have long COVID and ME. We will send a handout after the session with additional information. It would be great if you could reflect on your practices as we go along.
Post-viral conditions like ME have been around for a long time, but with almost everyone getting COVID, the prevalence has significantly increased in both adults and children. These conditions can affect anyone of any age, and even the mildest or asymptomatic viruses could result in severe symptoms. Those that develop long COVID or ME can face setbacks even with minor colds or reinfections, so please continue to look after your own health in order to keep yourself and others safe. They are considered to be invisible illnesses because while some symptoms are more obvious, many happen inside of the body. And around 25% of people are too ill to leave their beds or home for appointments or even receive home visits due to severe sensitivity to environmental factors such as noise, light, and temperature. There are a range of symptoms that impact on everyone differently, and these fluctuate, sometimes because the condition itself is exhausting to manage, but also because pushing through can worsen symptoms or contribute to the onset of new debilitating symptoms even months after the virus. This can be very confusing for everyone involved, and alongside a lack of specific diagnostic tests, can make it difficult to link a child or young person's condition to an initial infection. So as psychologists, we need to be curious and be thinking about this as a hypothesis, especially in relation to the pressures of school. There are some secondary issues that appear to be related to long COVID too, because it impacts on multiple systems in the body. Commonly, these include allergic reactions, sudden rises in heart rate or blood pressure upon sitting or standing, known as POTS, breathing and cognitive issues, and the mental health difficulties that are associated with the devastating impact of living with the condition. Currently, it's estimated that around 58% of people with long COVID meet the criteria for ME. A defining factor of ME is post-exertional malaise, or PEM, which is the significant worsening of symptoms such as extreme pain, weakness, burning muscles, or an inability to talk, think, or even eat after any activity.
The main types of energy can be cognitive, social, emotional, or physical, but all of these come from the same energy bucket. For example, if you use physical energy, that might have an impact on emotional and vice versa.
So whilst it's not a degenerative condition in the classic sense, it's one of the only conditions where pushing through is truly harmful and can cause significant long-term disability. This means that when you meet a young person, they may seem fine, either because they're pushing through or masking, or because they've rested often for days or even weeks in order to prioritize seeing you. So just think for a moment how precious their energy is and how important it is for us to reduce the energy cost to them.
Prior to getting long COVID, I was a really sociable, active, and outgoing young person who loved her sport taekwondo. I got infected in February 2022 with what I thought was a mild infection, but then symptoms started to get more severe and I didn't go back to school for around 6 weeks. I remember falling asleep on the floor trying to revise and having to make sure that I woke up early to get the most out of my revision time before I crashed. I also missed out on a lot of social events such as 18th birthday parties and the end of school events. Thankfully, I did do well in my exams. I got my place in university to study social work. However, I was becoming even more unwell, and unfortunately, I had to decline my place. Throughout that year, things were very challenging for me. I wasn't getting any medical support and I felt very isolated. The fatigue got worse, and I was still coughing and struggling with breathing. Life really started to change for me. In the summer of 2023, I started to get additional support from my long COVID clinic and medical professionals. I saw a respiratory physio who unfortunately really dismissed my symptoms as a young person, and he even told me that I should go on a 5-mile walk. I was really shocked as somebody who didn't know anything about post-exertional malaise and how harmful any activity and pushing through could be. As a young person, I didn't feel listened to or supported. I then joined my long COVID clinic's rehab program, which lasted 12 weeks. This was the first time I met anybody with long COVID, and it really helped me to feel less isolated. In September 2023, I then started my social work degree, but due to the lack of support and flexibility, I really struggled. I had spoken to my disability support officer around reasonable adjustments, however, these were very limited. I saw they really struggled a lot when I was at university, both physically and mentally. I was using all my energy up on being able to attend university. I was struggling to stay awake in class, and on the days I wasn't in university, I was bedbound due to the exhaustion. I wasn't able to do anything I enjoyed, like volunteering. I became really isolated from my friends and family. 2 days before my 20th birthday, I got reinfected again with COVID, and I'd only been at university 2 weeks. I then made the really difficult decision that I wasn't going to be able to go back to university due to new symptoms appearing. The attendance requirements in my course were really strict, and there wasn't a lot of flexibility or understanding around this. I also didn't have a lot of support around deadlines either, and the ability to record lectures. I probably would have found it helpful to have a mentorship scheme with somebody who had experienced chronic illness, or even just somebody to talk to. I also think more flexibility in terms of attending lectures, whether these be live streams or recorded. I also think that a more general awareness of chronic illness and the impact that it has on young people is much needed in universities, schools, and colleges. It's important that professionals really listen to the needs of young people with chronic illness and be empathetic and supportive to them.
Thank you very much for sharing your story, Eden. So there will be more information in your handout, but these are just a few good practice tips when you're meeting a young person. When we're preparing for a meeting, it's super important to read the background information beforehand to save cognitive and emotional energy, and most importantly, this means that the young person doesn't have to retell their story, which can actually be really traumatic to think and talk about. If it's not clear in the paperwork, check what you can do to reduce the energy load in the meeting. Consider what time of day might be most appropriate and the amount of time they might be able to manage. Could they record or share their views in advance, and who can help them to communicate on the day? When thinking about the environment, would it be best to have the appointment at home or perhaps online? Do you need to be mindful of things like noise, light, temperature? This is also all excellent information for the support strategies in your report. If they do need a home visit, reassure them that it's fine if they need to be in bed or laying down in their pajamas. Be extra sensitive, as the bedroom or home may be their whole world right now, and have a trusted person present to keep you all safe. Also, make sure that you prioritize being on time and don't cancel if possible. It may seem like it's just an hour or so for a meeting, but it's likely that the family have had to plan every detail, rest for several days before, and cancel any activity for days after your visit. It also takes a lot of energy to prepare mentally for visits and to get the support in place for the meeting. Also consider allowing extra time for the appointment so that you can fit in breaks for the young person and go as slowly as needed. In the meeting, you could tell the young person that you'll prioritize information that's most important to them in case they get tired or need to stop. Remember that whilst they're very capable, the young person may become easily tired, overwhelmed by information, or struggle to understand more than it seems. For this reason, it's always important to also listen to those that know them well. In these cases, adults are not talking over the young person, they are advocating for them. Make sure that you pace proactively. If it's online, this could mean spreading the sessions over a few days. Or in person, monitor the young person closely. They may push beyond their capacity, so help them by suggesting breaks every 10 minutes or so, or gently noting signs of fatigue, saying something like, I can see that you're getting more tired. Shall we leave it there for today? You could even do some short mindfulness practices during the meeting together. At the end of the appointment, sum up what's been discussed and agreed and what's going to happen next. All of these things will help you to get the most out of your appointment whilst prioritizing the child's needs. In your handout, you'll find some helpful questions that you can ask if you suspect an energy limiting condition, so that you can explore those further with the young person and their family.
Here are some of our takeaway messages. So the first one is explore alternative explanations with the children and young people and their families, and also make sure you're asking them the right questions. Give them a voice and allow them access to the support that they deserve. Listen, believe, and validate them, and be on their team. They know what will make life easier or better. Remember that the young people may know something physical is wrong, but they may not have the language or have been dismissed. Throw away the rule book. What might normally work can be harmful for young people with long COVID or ME, like exercise and socializing. Pushing through can have even more detrimental impacts.
We are motivated to do things and desperate to get better. We don't need encouragement, rather we actually need help to slow down and do less. There continues to be a lack of research, training, understanding and care for these young people. and because there are no diagnostic tests, they can be dismissed or blamed for their condition. Families have even been accused of neglect or abuse when they are just desperately trying to advocate and get help for their children. We have the skills and knowledge to raise awareness of this and the power to make a difference to our most vulnerable young people and families.
So now for a final thought.
Look for a moment at some of the possible symptoms of long COVID and ME in the table. Could they present as other conditions such as anxiety, low mood, or even eating disorders? Especially when we think of the tools that we use like rating scales that include many of these items. So we must equally consider physical causes beyond what we are told or see.
I'd like to leave you with this wonder. How many young people that are being supported with emotionally based school avoidance may have undiagnosed post-COVID complications?
Obviously, we cannot know the answer to this, but we hope that we have piqued your interest enough for you to keep physical causes in mind next time you see a young person with these kind of symptoms.
Thank you very much.